Nurses should regularly visit nursing centers so that they stay up to date. Things are always changing in nursing and healthcare.
If you want to stay current in nursing practice, Nursing Center is an excellent place for you to go.
The beauty in Nursing Center is that the editorial team who works on it refresh that site every single day. Every day you go to it, you're going to learn something new.
You can't just rely on things that you've done in the past, and because that's the way you've always done it. So there's absolutely a need for professionals to stay on top of what's new in the area, what's new in their practice.
There are many different opportunities for you to stay up to date on a regular basis by registering for newsletters, signing up for email alerts. There are an ability for you to use our RSS feeds to just stay on top of various topics that you're interested in.
Whether you work in maternal child health or whether you work in psychiatric nursing, you need to know what's happening in the world of nursing professionally, but also in other specialties, because no matter where you work or what your role is, first and foremost, you're a nurse.
If you really want to keep on the cutting edge of your specialty, your field, and you want to know exactly what you need for the bedside, come to Nursing Center every day, because every day we have new content.
And coming to a site like Nursing Center is going to really help you be able to refine your practice and provide that highest quality care using the best evidence and improve those patient outcomes.
It's true and it's honest. You're having nursing programs being developed online and live events by other nurses who are not just nurse consultants, but nurses who are practicing. So there's really nobody that has their finger on the pulse more than the nurses who work here at Nursing Center. And I think that speaks volumes to the quality of the content at the live events and the quality of the materials that readers see when they go to the website.
It's the highest quality content that's available out there. It's peer-reviewed, it's evidence-based.
Sometimes when a controversial issue comes up, it's so easy to say, oh, we have content to cover that, but it might not, you have to kind of time it right. You want to bring content to people that's going to help them. We're all part of the healthcare team, whether you work in ICU or home care, we're all working together for the best outcomes for our patients. So I think that you need to be sensitive to each other and also respectful of the patients and what's happening in the world, and not to jump the gun on some controversial stuff.
It's reliable and trustworthy. The name Lippincott is well known and is a reliable, trustworthy brand. That's what sets it apart, I think, from the rest of the sites out there.
And it's important for them to continue their education, and we want to make sure that they're up to speed with the most current practices. So that's why we feel it's really important to attend events such as ours. Being at the live event is really awesome. You get the opportunity to network with your peers and ask questions of the presenters face to face. However, I also think it's good to have both options, because after the live event is over, you want to be able to go back and see some of the things you missed.
Like Karen said, it's a good hybrid, the live events, because it gives people the opportunity to meet and greet on site. But then we also are capturing all of the session information and the speaker presentations on site and then offering them to the attendees. So if there's a session they may have missed when they were at the meeting because they went to something else, they have the opportunity to then go back to their facility and rewatch or relearn, which is kind of, you kind of get more bang for your buck that way. We'd like to have the attendees walk away with a feeling that they have not only accomplished something and learned something, but they've left their mark. So we partnered with the Ronald McDonald House charity in Orlando at this recent meeting that we had at Nursing Management Congress, and our attendees donated monetary donations and or gift cards for the families of Ronald McDonald House.
We had a great response.
It was a great turnout for the first year that we tried this, and everybody just felt so good about. And I think that really speaks to the character of just nurses in general. They're just by nature and by their profession is a giving, caring character. That's just who they are.
There's just something so special about a nurse, and so it must be genetic or something that is just for a true nurse. It's just something that not everyone has, and I'm honored to work with nurses and for nurses.
And it's so crucial in nursing and healthcare in general that you learn every single day. Coming back to Nursing Center, there is information on that site that you will be able to use immediately and to put into your practice. And that's why you need to come back to Nursing Center every day, and that's why people come to it.
Especially knowing personally the nurses behind the content. They are all career nurses who have gone on to get their doctorates. They are fully vested and they educate and they stay active, they still practice. To me, it would be a no-brainer. Why would you not visit Nursing Center every day?